Parts about delegation. Just an overview of what delegation is and a few of the terms. Delegation is the transference of responsibility and authority for an activity to a competent individual. In nursing, we delegate to the unlicensed assistive personnel, we delegate to licensed practical nurses, and sometimes as charged people, we delegate to other registered nurses. The delegate is the person who assumes the responsibility, while the delegator is the person who assigns the tasks and retains accountability for the outcome. Delegation allows the delegator to devote more time to tasks that cannot be delegated and enhances the skills, abilities of the delegate. In nursing, delegation is indirect care. So while it's still the nurse's responsibility, the intended outcome for the patient is achieved through the work of someone supervised by the nurse. The nurse asks another person to perform a task or skill, not part of that person's regular assigned work, and the nurse transfers responsibility for the task to the delegate, but not accountability for the task. Principles of delegation include that the RNs are increasingly delegate components of nursing care. That has to do with current workloads and being able to balance all the needs of the patient within the workload. So as I said previously, we're delegating to other nurses, LPNs, and unlicensed assistive personnel. And when you are delegating, you're choosing the appropriate skilled caregiver, and that's part of your responsibility as a nurse. And even if you delegate the task, it's still your accountability to evaluate the care, or in the case of vital signs or an AccuCheck, let's say, you're evaluating the findings that the delegate found. That was a bad sentence, sorry. Guidelines for successful delegation. You're going to follow the State Nurse Practice Act and facilities policies and procedures. It's very clear in the Florida State Practice Act, what the LPN can do and what the nursing assistant can do. And it's those things, only those things, that you can delegate to them, unless let's say patient care tech has been granted authority by the facility to do a few other tasks. And by granting authority, that means they've been properly educated in how to complete that task. You're going to follow state regulations, job descriptions, and policies. You can delegate only tasks for which you have both accountability and responsibility. You can't delegate to someone else something that isn't in your own scope of practice. You can't ask somebody to go perform surgery or to put a cast on somebody if that isn't part of your responsibility. Follow delegation process and key behaviors of delegating, which we'll be talking about soon. Accept delegation only when you clearly understand the task, the time frame, reporting requirements, or other expectations. And confront your fears about delegation and recognize which are realistic and which are not. As previously stated earlier, RNs can delegate to other RNs, and whoever accepts the assignment responsibility for completing care safely and completely. You delegate to LPNs and LVNs, and you're still responsible for ensuring that they complete the intervention correctly and appropriately. And the 5 rights of delegation include the right task, the right circumstances, the right person, the right direction and communication, and that's a two-way track. You communicate proper directions, and they communicate back that it was done or what their findings were, and the right supervision. So delegating to unlicensed assistive personnel, or UAPs, they function as nurse extenders. There's different categories depending on their level of training and experience. A certified nursing aide or assistant, they're certified by the state. They have taken a course, they have taken an exam and receive a certification and fall under all those responsibilities associated with being certified. There's home health aides, there's medical technicians, there's orderlies, there's surgical technicians, and one of the things roles we see in this area, and some of you may be even working as one, are patient care techs. So patient care techs are trained by the institution or oftentimes have completed one semester of nursing school and then become eligible. Nurse may delegate to them as employees of healthcare provider. Nurse may not delegate to patients' family members and friends because they do not work for the provider. So if a family member is feeding a patient, that's okay if that's what they're choosing to do. But if it's somebody at risk for aspiration, the patient's at risk to aspirate, then that's a nursing responsibility to make sure that that patient gets fed and that we're observing them for those signs. So it's not like we can say, hey, wife, hey, daughter, hey, husband, feed the patient. We cannot delegate to them. Just like when you're repositioning a patient in bed, you don't ask the family member to help you because you're putting liabilities there on the family member that the hospital isn't going to assume responsibility for. Nurse may determine whether tasks can be delegated to particular UAP for a specific patient. And what that means, to translate that statement, is that some facilities will train, or even some certificates limit or expand the scope of the UAP. And so that's why certain ones can receive certain tasks. And the UAP may not delegate tasks to another person. When you're delegating to a UAP, you must verify that the UAP understands the specific task to be done for each patient, when it's to be done, expected outcome for each task, including parameters outside of which UAP must immediately report to nurse, that they're having pain or that they're extremely short of breath and so they refuse, whatever it is. You have to be very specific about come back and report to me. Who is available to serve as a resource if needed? When, in what format a task report will be completed, written or verbal format. And what that means is that the UAP is allowed to document certain things. Is that what they're being delegated within their restricted documentation, or do they need to report it to the nurse in order for it to be properly documented? A specific task that can be delegated to one UAP may be inappropriate for different UAP, and that we discussed in the previous slide. A task that is appropriate for the UAP to perform for one patient may be inappropriate for a different patient, or even with the same patient in different circumstances. Principles for delegation to the UAP. I'm not going to read this whole list. I'll leave it up here for a minute so you can read it. But any patient that's unstable, any task that requires the nurse to do first time out of bed for a surgical patient, first time ambulating, somebody just received pain medication, a first time dressing change, all of those things need to be done by the nurse. If they require further assessment, that needs to be done by the nurse. And this is the tasks that should never be delegated by an RN: discipline of other employees, highly technical tasks, complex patient care tasks that require specific levels of licensure, certification, expertise, any situation that involves confidentiality or controversy. Things that can be delegated include vital signs, measuring intake and output, patient transfers and ambulation, postmortem care, bathing, feeding, gastrostomy feedings in established systems. That means that the UAP or the patient has already been receiving um, the uh, the tube feedings, and that the UAP has been properly trained. Attending to safety, weighing, and for tracheostomies, if it's a chronic tracheostomy, they may be taught to suction that. This goes back to a couple of slides ago, things that you can't delegate: assessment, interpretation of data, making a nursing diagnosis, creating a nursing care plan, evaluating care effectiveness, care of invasive lines, administering parenteral medications, inserting NG tubes, patient education, performing triage, or giving telephone advice. So a couple of practice questions here. A UAP has previously performed client transfers, bed to chair, safely on many occasions. It would be inappropriate to delegate this unsupervised task to the UAP under which condition? Here are your choices. I'm not going to read them to you. Take a minute to read them. Okay, and here comes the answer. All right, and I hope that you understand why that is the correct answer. Next question. A graduate nurse is caring for clients and does not want to delegate tasks to the LPN because the nurse feels that the responsibility for care belongs to the RN. As a result, what may the newly licensed nurse experience? Here are your choices. And here is the correct answer. Remember that trust really is a two-way street. And if you're a new person, you want to assume all the responsibility because you feel like it is your responsibility. If you don't share in that trust, if you don't delegate appropriate tasks or the workload, what you're saying to the other employees is that you don't trust them to do it properly. That's the end of part 1 of the delegation PowerPoints. There will be 2 more.